Every third Thursday of November in the United States is not just another day, it's National Rural Health Day, a significant occasion to honor and celebrate the tireless efforts of those who contribute to rural health care, whether it's through research, providing hands-on care, or advocating for policies. Their work to address and end disparities in rural health care is recognized in a meaningful way. While it's crucial to dedicate a day to rural health, we must remember that the work to improve the vital conditions that contribute to health outcomes and quality of life is not confined to or limited to those who work in the healthcare space. It's an ongoing effort by a multitude of cross-sector professionals who stay the course, think big, and act boldly, even when critically urgent resources stop flowing. Every single day of the year in every rural community across America, countless grassroots organizations and thousands upon thousands of purpose-driven, dedicated, talented, tenacious, and resourceful community leaders tirelessly work to fill the gaps of disparities. Their efforts inspire and teach us and help us appreciate the significant impact they have on their rural communities as well. In Massachusetts, a shining example of the power of rural is called the Rural Effect. Being rural, doing the work, and creating change. Through grant dollars that flowed from the Massachusetts Office of Rural Health to the New England Rural Health Association, which then reached over a dozen trusted community organizations, partnerships and systems were built. These initiatives brought vaccines to remote areas and vulnerable populations, identified gaps in food, transportation, and established infrastructure that helped connect people to resources and bring communities and cultures together, expanding the reach and their impact.
My role really in the Rural Vaccine Equity Initiative was the kind of high-level program oversight and really starting at the table from day one when we were notified both through our national partners as well as internally here at the department that there was a rural carve-out that was going to be happening with some CDC funds.
So what we did was working with our vendor partner, the New England Rural Health Association. We used them to be the grant-making entity so that applicants didn't have to jump through as many hoops and have as much understanding of complicated state grant-making processes.
Our network at the end of the day ended up with over 1,000 engaged partners. Us as the State Office of Rural Health alone, we do not have the capacity to be engaging that many folks at the end of the day. But by funding these community partners who held these large networks, we're able to really engage and operationalize these networks to be an active part of this, right? And so it became these extended arms where we were really both sharing power, sharing folks' ability to step into this work, and to come alongside and partner with them, right?
So I think that the flexibility has been tremendously important in this project. And the way I see that is really about values. It's recognizing that community organizations on the ground know what they need. And so our role in this project is helping to support what needs they're identifying rather than saying, these are the things we think you need to focus on from the outside.
There are people with social capital in communities all across the state. And once you tap into those people and tap into their networks and the communities of trust for which they work in, once you tap their knowledge of the community context that they're working in, it enables information to from trusted source to trusted source to trusted source.
The technical assistance that we provided in this project was really helping to make sure that if we think about this like ripple effect, make sure that the ripples aren't just, oh, this is how it's rippling out to the North Berkshires, this is how it's rippling out to the Outer Cape, this is how it's rippling out to the North Quadrant. Instead, to think about how are we connecting all of those places where this is sort of happening, and making sure that it's not just, oh, this is an individual impact, but how are we thinking about the collective impact and sort of a collective community across rural Massachusetts.
When we talk about the Rural Vaccine Equity Initiative specifically as a program of our State Office of Rural Health, it was a true experiment in true low barrier funding to the community level. And it worked.
Some of the highest vaccination rates in the state, in these rural communities. Just a proof that the model works. Investing in communities and our community partners works.
Today, on this National Rural Health Day 2025, you're going to hear from those who were touched by the ripple of grant funding and took the opportunity to make lasting waves of change. This is The Rural Effect, hosted by The Rural Impact. Are you ready? I sure am, so let's go. Hey, hello, one and all, and welcome to a very, very special episode of The Rural Impact. I hope everyone can see me out there. This is really an incredibly special live stream episode again of The Rural Impact. I am Michelle Rathman. And for those of you joining us for the very first time, we are the podcast that works hard to connect the dots between policy and rural everything. And today on this National Rural Health Day 2025, we sure do aim to shine a very bright light on the far-reaching and positive impact that grant dollars have when the resources flow through state offices of rural health to state rural health organizations and on to making their way to make waves in rural communities across the United States. So, and to do that, we are shining a really big spotlight on the state of Massachusetts and the work of the New England Rural Health Association and over a dozen rural serving community organizations and leaders really doing the heavy lift and the hard work and making lasting change. Now, in previous episodes, you probably heard me talk about my time in Massachusetts earlier this year. I had the distinct pleasure, really the opportunity to sit in the passenger seat and travel across the state for 3 days. I think it was about 3 days with a person who has been really a driving force in rural health in Massachusetts and really around the country for many, many years. You may know her, but if you don't, I want to give a very special shout out to Kirby Lessie, who leads the State Office of Rural Health in Massachusetts, for your tremendous hospitality and more than that, really providing me with an experience of a lifetime. Again, many of our listeners here, many of you out there know that I've been working in the space of rural health for almost 3 decades now. I've been a lot of places, and there is nothing like being in the places where the work is happening. So I got to witness firsthand the power of purpose and community, introducing me to the change makers that you all are about to meet. So again, welcome to our Riverside studio audience. We're glad that you're here. And to all of you joining us out there in YouTube, what an exciting time it is for us, even though we know that we are facing a tremendous amount of headwinds. You are all doing the work, making change happen. So, as I said, I am ready to go, and I know you are too. So, let me introduce you. We've got a whole bunch of guests joining us today, but let me introduce you to our first 2 guests, because first up, it is my pleasure to introduce you to Andy Lowe, Executive Director of the New England Rural Health Association. Andy, welcome. We are so happy that you are here today.
Thanks so much, Michelle. What a great honor and privilege it is to be with you to celebrate National Rural Health Day.
Thank you so much. And with that, I also want to bring in Ezekiel Baskin. Ezekiel is the Rural Health Program Manager for the New England Rural Health Association. And a few of those stops we made, Ezekiel was in the back seat. And it's just been such a pleasure and an honor to work with you, Ezekiel. To you both, again, welcome. We're glad that you could kick off this really exciting conversation.
Thanks for having us.
Okay, Andy, I am going to start with you because before we dive into the project, and Ezekiel is going to talk to us about it, the project that we were working on with you is called The Rural Effect. But before we talk about that, talk to us a little bit about the New England Rural Health Association, because you, after all, we talk about the ripple effect, the rural effect. You, if you will, were handed the baton to take this project forward from the State Office of Rural Health in Massachusetts. Talk to us about your organization and what it has meant for you to have access to these kinds of resources that were made available ultimately from the Federal Office of Rural Health Policy through the federal government, if you will, and then Massachusetts, and then to you. So a little bit about the organization and a little bit about what it means to have these kinds of resources available to make the impact that you're making.
Sure, Michelle. So the New England Rural Health Association, as we often call it, NERA, we've been around for more than a quarter of a century now. We are the Rural Health Association for all 6 of the New England states. And for people that may not be from our region, that's Connecticut, Rhode Island, Massachusetts, New Hampshire, Maine, and Vermont. We have over 600 members, and we have a mailing list of over 6,000 rural health professionals from critical access hospitals, rural health clinics, federally qualified health centers, in primary care, behavioral health, public health, oral health, university faculty and students, and many private sector partners as well from all across that spectrum. And we do a lot of membership kinds of activities, as you would imagine. We have a large annual conference that attracts over 400 people. We host a student summit, which drew over 100 students from 16 universities this last fall. And we have a number of projects and programs. And the Vaccine Equity Initiative has been one of our flagship programs for the last 4 years or so. This program is really a demonstration of how effective investments can be. In this case, there's a real waterfall effect. So we had the CDC, organizations like the CDC or the Federal Office of Rural Health Policy, which are just landmark organizations at the federal level, making an investment in the Massachusetts State Office of Rural Health, led by our good friend Kirby, and giving them the opportunity and flexibility and responsibility to turn those investments into real impact. And so from there, the state office made that investment and chose us. And as we heard in the opening segment, we were able to get those funds out to the community-based organizations with a minimum of red tape, with a maximum of flexibility. And those funds then find their way with very little administrative overhead down to those community-based organizations where they're making a difference. So we're seeing how these kind of investments really multiply impacts so far.
Yeah, absolutely. You know what? I want to, something you said, I really want to make sure that everyone out there understands that these dollars came out of an effort to ensure that vaccines reached communities that are remote, very difficult to reach. I traveled it, so I understand. I mean, we talk about rural, people sometimes have it in their mind. A lot of people don't even understand how rural of a state Massachusetts is. Ezekiel, I want to hop over to you because obviously, you have been instrumental in working directly with the community benefit organizations that we're going to hear from many of them today. I wish all could be here with us, but at the end of the day, it wasn't just, hey, I got some cash here, who needs it? There was a pretty, involved, although I know you all did your best to make it as seamless as possible for the grantees. There was a grant application process as a result. With that, I believe the number reached 16 different organizations across Massachusetts, all of them different. What is the range of the grant dollars to the organizations? I think, we can say that it was grant dollars, but what was the range? And from there, share some of the more technical details and the requirements of grantees, because, obviously you wanted to meet them where they were, but there is a process that you had to go through, right?
Yeah, thank you, Michelle. Absolutely. So the range of dollars in general, we were funding $75,000 per year per rural region. So a couple of our organizations were actually working in 2 regions, so they were funded at a higher level. And then we also had some flexibility meeting folks where they were at. So we started a couple of grantees midway through the project, so their funding worked out a little differently. And then towards the end of the project, for the final year, we were really focusing on asking the organizations, what do you need to complete the work that you want to do within this scope? And so some organizations actually took less dollars at the end because they'd found other sources of sustainable funding. Other organizations took some more dollars in that final year to really sort of set themselves up for success moving forward. And it was a huge range of kinds of organizations we were working with. So the thing we were really looking for in this project was who is convening partners in each region, who's bringing partners, individuals, organizations together to address social determinants of health, to address the greatest needs that are coming up within their rural region. And that looks really different in every region in rural Massachusetts. Rural is not one size fits all. And so, because of that, we funded a real range of organizations. You'll meet a lot of them today, which is very exciting. But everything from rural health networks with one staff member, maybe two staff members, to large regional planning agencies that are doing a lot of convening work and work on the ground in their rural communities, to community development nonprofits, a federally qualified health center, a couple of municipalities. So we really were working with a range of organizations, but the thing that really like threaded them all together was who is doing the work convening people in their region to solve problems.
In spending time with you and others on the project, it is my understanding that this was not something that you had just done before. I mean, this was a convening of a mass proportion once you got everyone identified and everyone was secured. And I happened to have an opportunity to join you at one of your meetings. And this was during, I want to remind folks, this was during some of the most stressful times for those who were in the public health space, and the work that you were able to do. We talked about the fact that what began as a rural vaccine equity initiative, but we're going to hear from these grantees in just a moment. Give us a sense of the ripple effect, Ezekiel, from your perspective, what you were seeing kind of early on in terms of how these funds were making an impact in vaccine availability and equity. And then we can talk, of course, a lot today about beyond that.
Yeah, so there's a tremendous disparity in vaccine access in rural generally, but in a state like Massachusetts, you can see it really starkly, where there are parts of the state where you can walk down the street to a CVS and get vaccinated. And then there are rural communities where that's just not an option. And so access was really the first thing that we worked on in this project, was building better access pathways for vaccination in rural communities. So we partnered with a state mobile vaccine program to bring mobile vaccination services out to rural communities. And with that, wouldn't have been successful without the boots on the ground community work, knowing where are people going in their community? Where is it convenient for them to get vaccinated? Will they get vaccinated at the library or the senior center? Bringing vaccines to individual rural communities that had never had vaccine clinics within their town before, and seeing that there really wasn't, if you build it, they will come, that happened. When vaccines were brought to people, they accessed them. And now we have vaccine rates in rural Massachusetts that are outpacing the statewide average. Before this project started, rural communities were behind. There was a significant disparity, and thanks to the work of our community organizations, investment from state government, and working collaboratively, we were able to really turn that around and change the vaccine landscape in Massachusetts.
Yeah, and that was a message that I heard over and over again. And for those of you out there, if you have not visited theruraleffect.org, I encourage you to, because every single of the organizations you're going to hear from today, you can see their numbers and see, data is important. Data does help tell stories. And you can see the data that has been collected. Ezekiel and Andy, you're not going anywhere, but we are going to welcome our first community benefit organization guest. If we can get Dave in here, it is my pleasure to introduce you to, did we get Dave? Okay, we were having a little bit of technical difficulty. This is a live stream, so no less. Get a little bit of feedback here, Sarah. So Dave, Mr. Dave Christopoulos, Executive Director of Hilltown Community Development. It's great to have you here. We know we're working out some technical things, but first, before folks know, I met another person on your staff, I might just say Joan. It was just so heartwarming to visit your community, to understand firsthand the challenges with access in terms of just getting from here to there, point A to point B. And so one of the things that made this opportunity work for each organization was that the work was not prescribed. And there is no cookie cutter approach to, you were applied for the grant, you received the dollars, but you had the flexibility to make needed change locally. So one of the things you share with us, Dave, that stuck with me, and I'm going to read this quote, is this: we're a rural region where systems aren't built for us, so we build our own. Give us a sense of how Hilltown CDC built systems, what systems were built, and an example of the impact that it had for the communities that you serve.
Thank you, Michelle. I really appreciate it. And I just want to thank you. It's been a pleasure to get to know you and work with you through this project. It means a lot to me. So I live and work in what's known as the Hill Towns of Massachusetts. It's the most rural part of the state. It's out in the western part of the state. It's very hilly terrain. And like you said, and I think like a lot of rural communities in our country, um, we tend to not have a lot of commercial activity. And an example of one of the systems that we've been building is our transportation system. We don't have fixed routes, and that's common in rural areas that have a lot of road miles. We don't, because of the population, we don't have a lot of commercial activity, including supermarkets. So one of the systems that we've been building is a rural transportation system that gets people to the most essential places they need to go, which is typically the hospital, the doctor, the grocery store. And our van service now is covering over 600 square miles of rural towns. Half the roads are dirt. So we're serving people who are living relatively far from population centers, and we have a much older than average population, which I think is also typical of many rural communities. So we're serving a lot of seniors who are aging in place, have worked their whole lives, contributed to the community, and now it's our turn to give back. They are our historians, and they are an important part of our community. And so a lot of our services are targeted toward people who have already contributed, and now it's our turn to help them age in place and learn from them all of the wisdom that they bring to our community.
Dave, I remember a conversation that we had really talking about capacity building, and you, for all practical purposes, I mean, you are constantly looking for grant dollars. And so I wonder if you could just talk to us before we move on a little bit about what it has meant to you to have flexibility with those dollars. So many of the grants that you apply for, I'm sure, are, unlike this one, quite prescribed, like you have to use it for this, you've got to show these milestones and so forth. For any of our funders who are out there, the philanthropy organizations, we know you've registered. What kind of is your message about being the trust that they should put in you to use grant dollars in a way that moves the dial, that really is making an impact without having to kind of have your hand held, if you will?
Well, great question. It really has to do with our business model. I think I've said to Andy and his staff that I'm so appreciative of this initiative because it's very uncommon to have multi-year funding in the nonprofit world. But we're expected to create change in our communities. And we all know that change is longitudinal, it takes time. So you're not going to do it in 12 months. You need multi-year funding to be able to work with people in your community over a period of time that's going to actually produce these results. So I think the multi-year part of it was really essential because it allowed us to think beyond 12 months, which is what you really need to do in community development. Also, they trusted our experience. Most of us have been doing this for decades and we know what we're doing. So we need support, but we don't need to be told what to do. We need to be given some flexibility so that we can work with the people in our community, deliver the services that they need. And that's what this project allowed us to do. It really respected local control, and it really respected the input of the people in our community to help us design these services that we're talking about today. I mean, that's the key to success in the community development field. So to have funders and partners that understand that and trust your years of experience, I mean, the proof's in the pudding, right? So I think that you want to invest in something that's already successful. And that's what we're able to demonstrate here. So, I think that we've seen massive returns on this investment in our community, and we've built a significant safety net for people in a rural community that, oftentimes that's one of the hardest things to do. So this type of initiative really allows us to get down to that level of cooperation and mutual aid.
Excellent. Thank you so much, Dave. Okay, the drill here. You guys are the wave is building. We're going to have you join Ezekiel and Andy because I am now really pleased to introduce you to another community benefit organization that it was one of those stops that it was kind of, I don't know, I sound like over dramatic here, kind of life-changing for me because I got to see something that I have never seen before. So I want to welcome to this conversation, Chelsea Patras, Executive Director of Health Equity Partnership of North Central Mass. known as Shana 9. I'm learning all my terminology. Chelsea, I met you near the very end of a very long couple of days on the road, and where we met and the topic we focused our attention on has stuck with me ever since. And I sincerely mean that because I really want our listeners in on this. But before we talk about where we met, because kind of a drum roll, please talk a little bit about your organization because you are you were up until this opportunity a mighty staff of one. Welcome to the conversation.
Thank you, Michelle. Yes, we absolutely were. So, CHNA 9 actually stands for Community Health Network Area number 9. And that is one of a couple dozen public health coalitions that were carved out across Massachusetts with a directive to put community voices really front and center alongside a strong network of organizations from all different sectors that touch public health. And to convene those organizations and those individuals to really drive big systems change that none of us could accomplish on our own. I say that we go an inch deep and a mile wide
Mm.
across public health. So we really work on everything from healthy and safe relationships and mental and behavioral health to food system work and transportation, housing, the built environment, racial and social justice. It really spans kind of everything that makes for quality of life and what like public health is everything, right? Is what we tend to say. And yes, before this funding, we were convening across 27 municipalities, approximately 200 or so organizations, and had a staff, a mighty small but mighty staff of one at the time.
Yeah, absolutely. And when we met, so I want to tell folks when we met, when Kirby pulled into this parking lot, it was a no longer in use elementary school, except the kitchen. And I don't have to tell anyone out here listening that we have a significant food security challenge in rural America. And we have all just faced some pretty challenging times where that is concerned. So today is the Power of Rural. We're celebrating National Health Day. So we won't talk about the negative because this story is so incredibly flippin' positive. I can't even tell you. So it's led into this kitchen. And Chelsea, take it from there. What in the world was going on there? You have an amazing partnership with an organization called
Growing Places, and I can't stop smiling when I talk about them, right? Okay, they're one of my favorite partners. Growing Places is an organization that just at their core believes that food security isn't about handouts and that healthy eating isn't just about consumer education. There's a whole food system that really just doesn't work for many people, especially in our rural areas. And when one of our towns lost its grocery store and became a food desert kind of overnight, we were working with Growing Places to do some assessment work. And what we found was a a lot of food insecure customers who, because of cost, time, accessibility, were purchasing much of their food at convenience stores and dollar stores. That is some of the unhealthiest food you can get. It completely lacks in fresh produce, and it leads to some of the worst health disparities that you can think of: rates of cardiovascular disease, high rates of diabetes. And it was because people just didn't have access. And while we were kind of focusing on this consumer end of things, we also learned that we have a lot of small and mid-sized farms in the area, um, who were really also struggling. They're struggling financially. They had no good way of selling locally because they were run by a very small number of people, one farmer, maybe a couple of farmers, um, and they couldn't accept SNAP. They couldn't operate at farmers markets because they just weren't going to get enough traffic to make it worth the while. We have a very short growing season in New England, so being able to sell produce is, kind of a short term opportunity. And so many of our crops kind of peak, and then you have this glut, and it's really hard to know what to do with them. So it was just a really inopportune way to be doing business. And so Growing Places really looked at what was missing in that structure, and they realized that what was missing was the mid tier. So they stepped into that space and became an aggregator and distributor. And so they opened up what you saw, which was this processing center where they lightly process and preserve produce that's aggregated from over 28 local farms. Um, and while they were doing this piece of the structure, we were working with a group that we had formed through another grant that was actually just kind of wrapping up, was our Anchor Collaborative. And that was a group of really strong partners that are our hospitals, our um, community health centers, our schools, and our universities that have some of the largest cafeterias and restaurants in the region. And we worked with them because we knew that we couldn't get food to consumers in a way that was going to be economical without the economy of scale of having large buyers. And our large buyers couldn't access food from our local farms because what were they going to do? Call up each farm and say, "Do you have lettuce?" Or, they couldn't accept hundreds of pounds of butternut squash because they had no way to peel it and cube it and prepare it. So having that aggregation and distribution piece that was able to do the light processing really made a huge difference. They could now, our large buyers became those community partners, and it was such a beautiful partnership because they were partners that trusted us to begin with. They knew the value of investing in the local economy. And all of this together kind of became what happens when a rural coalition has this shared vision and has built enough trust to ride through the bumps, because there were definitely bumps along the way,
Yes.
and to be able to share funding and connections and then celebrate our wins together. And, we're not there yet, but we are really in the midst of transforming our local food economy.
Yeah, it is remarkable. And the one thing that I also want to mention is that it is an economic driver as well. Because as I saw, I mean, you're employing people. I saw a young man in there with the getting in there and doing those, putting together portions of food in a safe kitchen with all this equipment. And it is just remarkable. And again, remind you, go to the ruraleffect.org and you're going to read about this organization and this great partnership. I mean, I think it serves, there's a saying, don't reinvent the wheel. And we also know that if you've seen one rural community, you've seen one, but the concept that you all have come up with and the ripple effect that is making is just remarkable. Chelsea, thank you so much for joining us. You know what I'm going to say now is you're going to join your colleagues.
Thank you,
And while I
Michelle.
introduced our next guest, thank you, Chelsea. So as we heard from Chelsea, when her organization became an RVEI, as the group was called, our Rural Vaccine Equity Initiative grantee, they were a staff of one serving 27 communities. But our next guest comes from an organization that has tremendous capacity and a resource, but they also cover a lot of territory as well. So with that, it's my pleasure to introduce, I think it was my first stop, is Phoebe Walker. And Phoebe is the Director of Health, of Community Health from the Franklin Regional Council of Governments. Welcome, Phoebe Walker, to the table. It's great to have you here.
Thank you so much. It's so exciting to finally be on your podcast after listening to it.
Oh, well, thank you so much. We appreciate that, Phoebe. So again, you were my first stop on the trek across Massachusetts. And like my time with Dave and Chelsea, many things stood out to me. The work of your organization, for short, we'll call it FERCOG, correct? And in the communities you serve. So let's start there by giving us a snapshot of those two things, a little bit about your community and the work of your organizations, because you guys are not occupying some small little building. You are a part of a much larger organization, but certainly a huge connector in this whole picture that we're painting here.
Well, thank you. Yeah, I mean, one thing that's really interesting about Massachusetts is we don't have a county government structure. So, unlike other states, our Commonwealth was made up of towns long before there was a state. So, our primary unit of government has always been these 351 towns. And when a long ago governor decommissioned the county structure we did have, the Franklin Regional Council of Governments was born so we could continue to work as a region. Our 26 towns cover about 725 square miles, and that ranges in size from the town of Monroe with 119 people in the last census, and our big city of Greenfield at just under 18,000.
And with that, you only have 5 pharmacies scattered across the region, and many primary care providers were not, as I read, offering childhood vaccines or clinics. And that's where FERCOG really did step up and step in. So talk to us about that work and the ripple effect from collaboration and the impact of these efforts in terms of vaccine rates.
Yeah, thanks. The rural vaccine equity funding came at a perfect time for us to address both the goals in our region, improving health generally and improving access to COVID vaccines, because our regional community health improvement plan, CHIP network, had a new health improvement plan that laid out priorities to address health needs upstream. And we could use some of this funding to begin addressing social isolation, youth development for immigrant girls, access to food, digital equity, mental health, and more. And those funds then brought us closer into contact with so many people who are already working to help people in our most rural communities. And those relationships then helped us address the vaccine priority. And in terms of vaccination, the way we did that was the CHIP and our regional health district worked together to address sort of what the barriers are for our region. We held clinics in all kinds of locations to meet people where they were: libraries, senior centers, housing, public housing, town halls, nonprofits that have parent groups, weekend clinics.
Summer camps too, right?
Summer
You guys
camps.
worked with the summer camps. You have a big
Yep.
summer camp situation,
Yes.
if you will, in your community.
It's a
And-
big
and you-
outdoor recreation area. Yeah. We convened school nurses and public health nurses for regular meetings to figure out what was a barrier in that school and how we could get a clinic there. We convened primary care providers because there aren't that many of them. We could all be in a room and talk about, why aren't you giving vaccines? Can we help you? We work to connect to the groups that are working with sort of particularly vulnerable people, like farm worker families and people in group homes. Did a lot of publicity, having a website that we update still today about everywhere, public and private, where you can get vaccine. We posted flyers at dumps and hair salons. And we made a regional newsletter for parents that included all kinds of resources and trusted information about vaccine safety. And if none of that worked, our public health nurses were also able to go out and physically visit people in their homes to give vaccines. So as a result, our vaccination rates were outstanding compared to other areas of Massachusetts. And the flexibility of this money really allowed us to do this great work, kind of building our capacity generally, and then building this particular health.
Yeah, thank
issues.
you. And we'll talk about this later when we all come together, because one of the themes of opportunity, if you will, that I see the threads with all of you is that you already had the trust of your communities in many ways, but you've just strengthened that trust. And my goodness, how is that serving you today, having that trust? So Phoebe, thank you for joining us. We're going to have you join your colleagues on the other side, because now I'm going to bring in our next guest, which is Connor Robichaud, Director of Regional Services and Collaboration at Central Massachusetts Regional Planning Commission. Connor, welcome to the Rural Impact Conversation on this National Rural Health Day. It's great to have you here.
Thanks, Michelle. I love it when this group comes together. This is great.
It is great. I said these people are going to get sick of hearing from me because I'm like, we're going to do this on National Rural Health Day. So you guys are not directly in the business of rural health per se, rural health care, but most of the work that you do does make an impact in rural health and quality of life. So give our audience and our listeners kind of a snapshot of the work that you do there at your organization. We'll start there.
Yeah, no, we're not a healthcare provider, but similar to Phoebe's group, we're a regional planning commission. We do work upstream that touches almost every determinant of rural health. So transportation access, housing stability, education, digital equity, public health capacity, social connectivity, across 40 municipalities, from the second biggest city in New England, Worcester, to dozens of small towns that are rural and resource constrained. I'm here to help communities collaborate, pool staff, and build services that would be impossible for any one town to sustain on their own. So through this initiative, we're able to expand that work and really focus on the conditions that either enable or prevent rural residents from accessing care. And that meant working directly with public health teams, local governments, and community organizations to understand the barriers people were facing and design on the ground solutions.
Yeah. I want to put a shout out. There's an organization, if you're not familiar with the Ripple Foundation, I'm going to send a special shout out to my friend Rebecca Payne, because she talks so much about the vital conditions. And one of the ripple effects, if you will, from your work is that your focus was on developing transportation solutions. And we heard that all over the place. I mean, food security, transportation solutions. So share more about the challenges you were working to help overcome, and what form those solutions took, because again, with the RVEI funding, I also wanted to have you talk to us a little bit about another kind of component, which is the happy factor. So talk to us about the transportation and then the happy factor, because I like to be happy. I'd like to have you talk to us how we make that factor that into our lives.
I know it's good branding, right?
Yeah.
One of the biggest barriers we heard across our rural communities, and it wasn't the first time we were hearing this, was transportation, like Dave talked about, especially as smaller healthcare offices sort of consolidated out of rural areas. We had people traveling, an hour for basic care, even further for specialty care, but many didn't drive or couldn't drive because of age, disability, or cost. So this funding allowed us to go far beyond identifying the problem. It let us prototype some solutions. So we knew this was a major gap. We could work with local transit providers, councils on aging, and regional partners to build new transportation options tailored to rural reality. So we built up a micro transit model that provided on-demand trips with smaller vehicles, triaging first with any existing services, and then filling those gaps to make absolutely sure people could get to appointments, pharmacies, essential care. And this gave us the space to say, transportation is a health intervention, and rural communities need systems designed for them, not a watered down version of an urban model.
Yeah, thank you for that. I think for any of you who are watching us out here, again, we're live on YouTube and we've got a live audience. If you have not traveled, I heard a phrase a couple weeks ago, you have to walk the paths of others. And as Dave shared with us earlier, it's not that easy to just, you just can't walk to the grocery store. I mean, drive around rural America yourself sometime and see how difficult it can be. So I appreciate you bringing that up, because I think it's quite easy for us to take for granted that you just hop in your car and go somewhere, or you just have access to public transportation. And what you all have built, really does provide that opportunity for folks that they didn't have before. And the goal here is that you can sustain it, that you can continue to fund it. All right, Connor, I'm going to have you join the others because I want to introduce you to our next guest. And she is involved with an organization that when I interviewed its co-creator, Monica Moran, who could not be here with us today for the project, but she was able to join us, someone else to take her place to talk about it. I just want to tell you the conversation I had with Monica, and I encourage you to watch Monica's video on the ruraleffect.org. It was so powerful. And for so many women I know and people I know, this is a subject that is very near and dear to their heart, and it's quite relevant for the times that we are in. So with that, it is my pleasure to introduce you to Ilana Gurjoy to the conversation. And Ilana also works with FRCOG, but she's also a steering committee member for the Rural Network to End Domestic Violence. Something that I believe if we're all being truthful with each other, we have to recognize truly is a public health crisis in this country. We don't think about it in terms of health equity, but not any longer, because we're going to have that conversation right now. Ilana, thank you so much for joining us today.
Thank you so much for having me. It's wonderful to be here.
All right, Ilana. So tell us a little bit about it, and not in your official capacity with FRCOG, but tell us a little bit about the organization that you're on the steering committee, and we'll just take it from there.
Sure. Yeah. So the Rural Network to End Domestic Violence is a network of domestic violence task forces across rural, western, and north central Massachusetts, which is a lot of the area you've been hearing about today already. But before I go further, some people may be wondering, what a domestic violence task force actually is. And it's just really a group of people who come together in a local area because they care about addressing abuse and violence in their community, or because it's part of their job. So they might bring different types of roles or expertise to the table. You know, advocates, healthcare providers, school staff, police, faith leaders, and then often people with lived experience too. And they come together to ask, what's getting in the way of survivors getting help here in our area, and what can we do about it? So they might do something like raise awareness about resources, improve how referrals happen, support prevention work with youth, or find creative ways to reach survivors who don't have reliable transportation or cell phone service, for example. And so in these rural areas where the resources are so limited, strong partnerships can really make all the difference. And task forces help to make the response more coordinated, more accessible, and a better fit for the individual community. So back to RNEDV, the Rural Network, basically, you know, most of these little task forces have little or no funding, and they might cover, you know, pretty spread out geographic areas or tiny towns. And so the Rural Network brings this backbone support that helps to strengthen the task forces work and to keep them connected. So you asked about the mission. This is it, and this really guides everything we do. The mission is that we work to prevent and reduce domestic violence in rural, western, and north central Massachusetts by building, connecting, and strengthening community-driven domestic violence task forces. And we do this by fostering regional collaboration and advocating for rural needs statewide. And in terms of the region that we serve, yes.
Well, go ahead, and then I want to have a follow-up question for you.
Absolutely. Yeah. So you had asked about the region that we serve. It includes about 200,000 people, but a lot of them live really far apart and don't have full-time police. So instead, the state police often respond to emergencies. So just one quick example before we get to your other question is that the Russell State Police Barracks covers about 365 square miles with only 2 troopers on at a time. And depending on weather and road conditions, it can take up to an hour for them to reach someone who calls for help. And so that's why strong local networks really matter in these rural communities. They help to ensure that survivors can get support quickly, safely, and close to home.
Boy, that paints a picture for me. I don't know about the rest of you. Ilana, one of the many insights that Monica shared with me during our interview in preparing for the Rural Effect website was that the funding made this was from Monica, made visible a hidden crisis that many experiencing intimate partner violence could not access vaccines because they were not free to travel, speak, or act on their own behalf. And on October 31st, you wrote a health policy social media blog, if you are a social blog, and racial justice article entitled Intimate Partner Violence in Rural Communities, What We Know and What Can Help. How did the RVEI grant funds make a difference in the network? And I really want to make a plea for those of you who have the resources to be thinking about, if you are giving, how you might be able to include this into your plans for 2026, because this is something that is not going away, and it's increasingly difficult in rural communities because of what you've just described.
Thank you so much. So I'll just touch briefly on all those points. So yes, accessing health care, including getting vaccines, can be incredibly difficult for people in abusive relationships because abusers often isolate their partners, control, when they can leave the house, monitor their phones, or decide when they can seek medical care at all. So those challenges are even harder in rural communities for all the reasons that we've been talking about today. Mm-hmm. And in the article I wrote recently for Those Nerdy Girls about intimate partner violence in rural communities, I shared that the impact of domestic violence is often more severe in rural areas. And so that can lead to more serious physical harm and less access to preventive health care. People are also less likely to be asked about their safety during pregnancy. So all of these things are challenges. And this is where the RVEI grant made such a meaningful difference. It allowed us to actually launch the Rural Network, something we probably couldn't have done without the support. I talked with Monica about this, and she really said that we wouldn't be where we are today without this funding. And it was just really important to her and to all of us that the funding didn't just support the logistics, but it really showed that the funders understood how deeply connected domestic violence is to broader health issues, like you were saying. So when we strengthen the local safety nets and we help people in abusive situations get support, we're also improving access to healthcare, vaccines, and overall health equity. So the RVAI funds made it possible to bring the task forces together, build relationships across regions, and start addressing these challenges in a more coordinated way.
Excellent. Thank you so much. And then real quick, you also have the first in the nation support line called, it's www.callforchange.org. Can you just touch on that for just a second?
Sure, yes. So in this region, this is a helpline that anyone can call who is interested in learning more about whether their behavior might actually be potentially abusive, or if they know someone and they're concerned about that person's behavior. Trained advocates help people understand what's happening and how they can take steps towards safer and healthier relationships. And that's why it's a first, because most hotlines are for people experiencing abuse, not people who might be causing it.
Wow, that is incredible. Thank you so much, Ilana, for joining us. Thank you again and again and again, folks. We've got a few more amazing change makers coming up. So again, we're going to ask you, Ilana, to join your colleagues on the side. And it is now my pleasure, and I hope we have Jennifer Golway, Director of Southern Berkshire Rural Health Network. We have you. I'm not sure if we got your audio here, but can you hear me, Jennifer, okay? Yeah.
Yes, I can.
Okay, good. So listen, a visit to your community. I mean, I met you, and just tell folks, I think it was one of the last stops of whatever day I was there. I lost count. We met in the library. We were running really late because we had a lot of territory to travel, and the library was checking their watch because they wanted us to leave. So we did a walking tour of the community. And you know, when you walk into your community, it's like walking into the pages of a beautifully illustrated storybook, charming downtown, beautiful architecture, breathtaking views. And then there's another part of the story. So often, we left off the glossy pages of these tourist guides like other RVI grantees. Southern Berkshire Rural Health Network is on a mission to address unmet needs in your community. Not by providing direct service per se, but through the power of problem solving and partnership. So let's start there. Jennifer, talk to us about the work that you all are doing.
Sure. Thank you. It's a pleasure to be here today. And you're right. So the Southern Berkshire Rural Health Network, we bring people together to drive systems level change and spark that innovation and drive that change forward. And we do that primarily through convening. Our mission overall is committed to working with organizations and individuals within our South Berkshire community to address all of the social determinants of health to support the overall health and well-being for the members of our community. And so everything we do really holds that close to our focus, with a vision that we're working towards creating a culture of health in Berkshire County. And over the years, we've had a lot of accomplishments. I'm fairly new in this role, but we have a lot of accomplishments, and we're currently working on a lot of different initiatives.
Yeah. And, you said you're new to the role. So one of the quotes from your predecessor, who I had the opportunity to walk with, is Deb Phillips. Thank you, Deb.
Yes.
Hi, Deb. Deb shared this as a quote from Deb: "The work that doesn't get funded is the work of convening. But through the RVI grant, convening was exactly what you all were able to do. And that includes in the affordable housing space." So we've talked about food and transportation. We've talked about access to vaccines. So talk to us about your work with the Great Barrington Affordable Housing Trust. I wonder if you could touch on that for a moment.
Absolutely. So this is our key partnership for our focus on housing at this time. And this is a really exciting partnership. So the Great Barrington Affordable Housing Trust Fund acquired some land in the village of Housatonic, a part of Great Barrington, and it is in the early stages of development. And the Southern Berkshire Rural Health Network has been working in partnership with the Great Barrington Affordable Housing Trust Fund to serve as the convener, really to work hard to bring the community together around this important initiative. And it really, with a specific focus on being inclusive, having opportunities for feedback that were accessible, really engaging with the community in ways that were meaningful, to really get a good pulse on what the needs are, what they're seeking, and making sure that their input is really elevated, and building trust around these types of initiatives. And I think one of the things that has really come up in this project is really that ongoing dialogue with the community around what does affordable housing mean to our community, beyond what, other measures will tell us and what affordability is and AMI and all of those things, but what does our community need, the wider community, the neighborhood, those who live, work, and play here. So with this, and within this partnership, we have worked to lead, meaningful community input efforts. So we started off by really coming up with an intentional outreach plan in terms of, making sure people understood that the project was happening, details around the project, letting them know when and how there would be opportunities to provide valuable feedback. In addition to that, we helped create a survey, taking the lead on that. And again, really trying to dive into the details, right? Some of the feedback we do want is around design and how it fits into the neighborhood and things of that nature. But I think we all know the connection between housing and so many other things that our community members hold close to our heart. And so all of these engagements have really stayed in focus around that. In addition to that, we really have tried to make sure that the community input efforts are being done through an equity lens, and ensuring who normally isn't able to provide feedback, who's not typically engaging in these conversations. And some of the things were, simple things to implement into these engagements by offering a survey that's online that really paralleled the in-person, feedback sessions, making sure that they were also provided in Spanish, the second most popular language in our community, offering things such as an offering on the weekend, an offering during the week, but also providing childcare and things of that nature, and transportation. So it really, the feedback that the Rural Health Network has gotten from the Great Barrington Affordable Housing Trust Fund is that they've learned a lot from our approach around elevating all voices as much as possible to solicit this feedback.
Yeah, Jennifer, I am so glad you brought up the equity, and everyone else has talked about it as well, what you've just described. I mean, I think, again, everyone who knows me on this show knows that I will continue to use the word equity until until the day I am no longer here, and I'll use it in the afterlife then too, because what you've just described is equity, making sure that you remove language barriers, that you meet people, some people work 3 jobs, and so you have to make sure that you can accommodate them. So thank you for that. And the last thing I'm going to say is I don't remember where I heard this or read it, but I love this saying, and I'll plant the seed before we bring in our last guest, which is, if only affordable housing was considered edible food. And so I think about the kind of work that you are all doing, and I know there's another RVEI grantee, the Valley Alliance on Ezekiel, you'll help me and put it in the chat, but it's all about land equity as well. So thank you, Jennifer, for sharing that side of the perspective, because now we are talking about these social determinants, these non-medical needs that very much are a part of it. So Jennifer, I'm going to ask you to join your colleagues, because we have our last community benefit organization. Before we open up, we got lots of great questions that I'm seeing in the chat. But first, I want to just remind everyone we are here doing a live stream recording for the Rural Impact on National Rural Health Day 2025. So we wanted to end our one-on-one conversations with an individual whose organization is in the business of providing direct healthcare delivery at a place where unfortunately I did not get a chance to visit because we just darn it ran out of time. But I want to welcome to the table Lucy Hackney, Chief Operating Officer of Island Healthcare, a federally qualified community health center serving the island of Martha's Vineyard. Lucy, where are you? Welcome to the Rural Impact. We're so happy to have you here.
Thank you so much for having me.
Oh, there you are, Lucy. Great to see you. Again, like I said, Lucy, unfortunately, I was not able to have the opportunity to visit Martha's Vineyard. I'll tell you, the thing is, in my mind, when I think about Martha's Vineyard, I just think of, again, picturesque and high wealth and, fancy, restaurants and, these beautiful people. And all that is true. And there's another side to that story. So, Lucy, your involvement in the initiative was centered on delivering vaccine clinics across the towns you serve, embedding vaccines in primary care visits, and staffing community health workers who brought trusted care to neighbors, to doorsteps. But we know it was so much more than that, because you share with me that the pandemic wasn't just about vaccines. It was about seeing the deeper health disparities, which unfortunately many do not realize exist in a place known for both high wealth and prosperity. So what are the inequities you all set out to address with this grant, and tell us how you did it?
Awesome. Thank you so much. As you mentioned, Island Healthcare is a federally qualified health center. So just for a little bit of background, that means we serve everyone regardless of insurance status or ability to pay. We provide comprehensive primary care, behavioral health services, dental services. We also do quite a bit of work in the public health space. And I think as an organization, always trying to make sure that we provide support for the social, financial, and environmental factors that some estimate can account for up to 80% of someone's overall health. So it's really important to us to recognize and support those things. So as you mentioned, I think a lot of people do have preconceived notions about Martha's Vineyard, but despite its scenic beauty and wealthy, famous visitors, the island really does face serious challenges that stem from not only its rural nature, but also its geographic isolation and the seasonal population variability. So for some context, our population grew a lot during COVID. It used to be around 17,000 and it's up to 21,000 as of 2024. But the population swells to over 125,000 between the months of June and September. So the ongoing health disparities for and among our community are driven by, I think all rural experiences, transportation barriers, limited housing availability, an astronomically high cost of living, and an average wage that doesn't support it. So you might expect that the wages are much higher and therefore can support the much higher cost of living, but that's not really what's happening. Workforce shortages, just to name sort of a few of those factors. And I think what we all saw during the pandemic was how patients with chronic conditions like diabetes, high blood pressure were hit harder by COVID. And we know that low-income communities and some marginalized groups face higher rates of some of those chronic conditions, often because of barriers to access to healthy food, nutrition education, preventative care, and things like that. So when COVID came along, it really amplified the health disparities that already existed, and really, once again, highlighted how important it is to address the social determinants of health. So originally with this grant, we set out to try and address some of those underlying health disparities and inequities by improving access to fresh produce and nutrition support, while also building community through food.
Yeah, and I'm glad that you brought that up. I owe you a paper that I talked to you about yesterday,
Yes.
but you have this amazing program that this is not something that you all created, because I'm assuming it's the same model that came out of HHS, which is the Food is Medicine program. or it might be your similar one to that. But talk to us about your fresh food prescription program and its impact, because it's incredible.
Yeah, thank you. So yeah, with this grant, we designed and implemented a produce prescription program that essentially provides fresh produce to patients who are experiencing food insecurity and who have a diet-related chronic condition. So they enroll in the program for a year, and then in addition to the access to fresh produce, they can also get one-on-one support from our registered dietitian. We have monthly cooking and nutrition workshops, access to a recipe library that incorporates culturally relevant foods, and more. I think one thing to note is we also had an emphasis on connecting patients with like equipment and supplies that would set them up for success. Because I think that's often a missing piece is like if like one story that always stuck with me was a patient who said part of the reason that they didn't really eat a lot of produce was because they lived with 8 other people and didn't have room in the fridge to store it. And so we were able to work with them, get them their own mini fridge. And it was kind of amazing to see how that sort of like small thing really empowered that patient to feel like they were in control of their health and their choices. And then in addition to the produce prescription program in the later years of the grant, we were also able to offer a wellness program, which built on a lot of that work. So that program brings together a diverse cohort of patients with a specific chronic illness, like diabetes, hyperlipidemia, things like that, for a 6 to 12 week period to learn how holistic interventions like food, but also physical activity, mindfulness, and stress management can improve overall physical and mental health, and also how we can make those things accessible and relevant to our community. So both programs, I would say, were really, really successful. And a couple data points, I think both with quantitative and qualitative data, we just saw some really incredible results. The wellness program, something that was really incredible to see the connections that were built. So at the end of the course, you know, patients would be exchanging phone numbers and making plans to meet up and do weekly walks together and stuff like that. And so seeing that sort of community building happen organically was really amazing. And then on the produce prescription end, we did collect a ton of data, which was fantastic. I'll highlight one of the most promising outcomes, I think, which was that 100% of the patients who participated in the full program increased their daily intake of fresh fruits and vegetables, often doubling or tripling their baseline. And since, you know, the research shows how important that is to reduce the burden of chronic disease and also improve overall health and well-being, we were really proud of that measurable success.
Yeah, I mean, it's incredible, and to be able to see what works. I think about during COVID and some of the Native American communities where water was an issue of accessing clean, fresh water, which still goes on today. Food, transportation, housing, all of it. The impact that you all are making is incredible, and I just think about how easy it is to ask a question. You know, we can assume that everyone has a refrigerator. Don't assume that. We can assume everyone has running water. Don't assume any of that. And when we ask questions, we can meet people's needs, and not just one person, but build systems around that. So Lucy, thank you so much. Okay. Oh my gosh, I'm looking at the clock. We're going to open this up to questions. And I'm going to invite anyone who can offer an answer to this first question that's coming in. Then I want to talk a little bit about policy shifts and a few other things. But one question that Carolyn asked is, how do you navigate the vaccine hesitancy that seems to be more common, at least in my experience, in rural communities, especially after working so hard to get these vaccines to our communities? So Phoebe, you've got your hand raised, eager to answer that question. Go ahead. We'll do Phoebe.
It's definitely continues to be a serious issue. And the question answerer is absolutely right. Question asker. I would say that there's a couple things that we have done to deal with this. One is building close relationships with our school nurses to make sure we know what they're hearing and we help support them in having answers. Also making sure again that the vaccines are happening somewhere really public and comfortable and trusted. So that's sort of a gentle social norming, you know, And if it's at your elementary school during parent night, if it's at your high school during a football game, it's more comfortable. I would say another thing that we did during this period was we had a very popular parent newsletter that our Youth Substance Use Prevention Coalition, the Communities That Care Coalition, was the authors of. And that was a place where parents could turn to for good advice about everything from recipes to how to talk to your kid about sex, what are some fun things to do this weekend, where can I get free diapers, and also what's the truth about this vaccine. So again, just working on being in relationship and being trusted and being a place that is transparent and accessible is the best we can do. But I want to say it's certainly a continued issue, and a lot of people have branched out from their hesitancy around COVID vaccine to other childhood vaccines, and we are deeply concerned about that.
Thank you. Ezekiel, what do you say about that?
Yeah, I agree with everything that Phoebe said, and just also wanted to throw out there that I think it's really long term, the work on building trust and community. And so it's not just having one conversation with someone about vaccine and then, they're not hesitant anymore. It's about being in continued relationship, and also recognizing that every aspect of the work sort of is about building trust. So if someone has positive interaction with, to use your organization as an example, Phoebe, if someone has a positive interaction with the community health department through a restaurant inspection, then they're more likely to feel trust when the vaccine clinic rolls around. So recognizing that all of those things really work together to build trust.
Yeah. Lucy, because you are in a clinic setting and you guys are getting questions, and, now there's just so much. We did an episode the very early part of this year, maybe it was even last December, I can't believe a year has passed, called Seeds of Doubt, which is all about disinformation and misinformation around public health issues. Lucy, what are some of the strategies that you all are using to build confidence and be that trusted source that people say, no matter what I'm reading on social media or what someone told me or what I heard, this is the people I can trust? How's it working?
Yeah. I mean, I think everything Ezekiel said was so spot on. Like, it's really about building the trust over time. So if the first time that a person hears from you is you telling them to get a vaccine, that's really not going to resonate as much as if it's the community health worker that they've seen at the library every week for 3 years is like, oh, hey, did you know? And then is able to have that conversation. So I think building trust through community engagement over many years sets you up so that when there are situations like this, like the pandemic, you've already kind of laid the groundwork so that people know that you're there for the community, and you can be trusted. And also, I think in a primary care setting, the trust that the primary care providers build with the patients, and really making sure that patients feel heard and that they feel like when they come into the clinic, their cultural and linguistic needs are met, again, sets you up for success when sharing this type of important information and feeling like they'll really receive it and know that you're a trusted source of information.
Yeah, it's great. And I tell people what possible reason would I have to not be honest with you? That's a good question. Ezekiel, you have something else to add to that?
I just can't help myself. I just off of what Lucy was saying, I think the importance of continued funding is really critical in continuing to have that community health worker there at the library every week. So then when there's a crisis, the relationship is there. I think when we fund in a crisis way, where we have a lot of funding infused when there's a crisis, and then the funding dries up and we aren't able to keep those networks going, it makes it really hard to maintain trust. So the importance of continued funding to build these continued relationships and build trust with community.
Yeah, I could not agree with you more. We need to fund prevention. I have a saying, folks, we deal with that which we choose not to manage. And so if we funded on the front end, we wouldn't be dealing with so many crises on the back end, one can assume. I have two more questions for everybody, and I got another one in the chat as well. Right now, we all know that we've been hearing about every single state, including the state of Massachusetts, through a lot of hard work from a lot of really dedicated people, I know Kirby was very much involved with that. We have the Rural Health Transformation Program or Fund, $50 billion of an investment from taxpayer funds that are going into communities and so forth and so on. And so I wonder if, and I'm going to start with Andy. I wonder if you could say to those who are decision makers out there, what is going to help really transform rural health in your communities? What does that, I mean, the work that you're doing is doing it. So what does rural health transformation, what does it need to happen where you sit? Andy, I'm going to start with you.
Sure. I think the important thing that we've really lobbied hard for across all 6 states is to make sure that the funding makes its way to rural communities and providers. This is going to be, as people know, anytime you have $100 million a year coming for 5 years to each state, it's going to be a big money grab. We really want to make sure that there aren't a lot of consultants getting money and it not making it down to these communities. You can see this has been an example of how powerful a fairly small investment can be. And I think one of the key things that needs to happen is for everyone to make the case that rural health initiatives like this, they're about health, but they're also, it's an economic development project. And several people have touched on that, but the power of this to transform communities economically and as well as in their health, those two topics are intertwined and you can't separate them. So I think involving our business community is going to be key, as well as the other sectors. The states were really good about trying to have a transparent process that was very inclusive in getting input. But when it gets down to it, we're going to have to try to make sure we hold people accountable, that the money makes its way to rural communities. And again, it doesn't take a really huge investment to make a difference. One of the things that we've suggested to all the states is that we pool some of this money to do a regional approach. We don't need to do the same administrative thing in each state. We would love to take this project and make it work across New England.
Absolutely, across, and maybe an example for the rest of the United States, perhaps. Chelsea, I'm gonna have you jump in here, and then I've got a couple other questions, and then a final question, and then a few announcements we have to make as I'm watching the clock. Chelsea, you've been patient. What do you think?
I absolutely agree with what Andy was saying. It needs to be local funding and it needs to be flexible funding. I think, just from hearing about everybody's projects and how they kind of springboarded off of things that they were already had momentum in their communities and were able to pivot in ways that took advantage of opportunities and addressed emergent needs. That we need that flexibility, right? And we need to be able to bring the right partners to the table. Um, there's nothing people in rural communities hate more than when somebody comes in from the big city and can't pronounce the name of any of their towns.
Are you talking
lose...
about me, Chelsea?
No. You lose trust so fast when you're trying to, implement projects and programs in that kind of way that is that just kind of comes in and disappears again when the funding runs out. So we need to build things that are actually transformational, because they have that kind of like embedded longevity.
Yeah, thank you. That is so true. And I know I've been hearing from my colleagues across rural health, like there's a lot of consultants out there ready to help, which is great. But to your point, the money needs to go where it will make a difference. Phoebe, what say you?
I really appreciated how wonderful the process was in Massachusetts, how much we were allowed to give input, and I'm really hoping that funding that comes to Massachusetts will build workforce and infrastructure. At the very least, we have no visiting nurses. We have problems with home health aides. We have robust attempts to get doctors to move here that could use support, and then sort of technology infrastructure that we need in terms of electronic medical records, interconnectivity with that kind of stuff. So I'm excited about what the possibilities are with that funding. I do hope it continues to support the kind of incredibly, frankly, cost efficient work that we were all doing to make change and improve health, but also some of those kind of serious access issues that rural America has.
Yeah, absolutely. Real quick, Ezekiel and then Connor, I wonder if you could talk about this too. You all just for structure purposes, there's this RVEA Learning Collaborative. And Ezekiel, real quick touch on that. And then Connor, I want you to just kind of reflect a little bit about what it's been to be a part of that learning collaborative before I ask each of you to answer my final question.
Wonderful. Thanks, Michelle. Yeah, so the Learning Collaborative was a key part of this project. We gathered the folks you're seeing here on the screen and many others from our rural community organizations together 1 to 2 times per month for multiple years through this project. And it was really a peer learning network. So folks were able to share the successes they were facing, the challenges they were facing, problem solve collectively. We had guest presentations where people came and shared resources and skills. We did little lightning rounds where multiple regions would share, how am I addressing transportation in my region? How are we addressing food insecurity in our region? We had guests from various parts of the state and outside organizations coming in and sharing things and getting input from our sort of rural think tank on how is this working to reach rural Massachusetts? How is it failing to? Will your statewide survey reach rural communities effectively? And if not, how could we make it better? And that was really, I think, powerful and impactful. And it also built this strong network that you sort of see today of rural Massachusetts together from the furthest west, from the Berkshires and the hill towns in Franklin County to the furthest east, the Cape and the islands, really coming together with a shared identity as rural Massachusetts working together to solve problems and address challenges.
Yeah, thanks for that, Ezekiel. Connor, you're with a bigger organization. I'm just wondering, we kind of assume, well, they don't need our help or this might not be, relevant. What was it like for you to be a part of this, and kind of what is your hope for being able to carry this work forward with a group this size?
Yeah, I do work for a bigger organization, but our public health staff was nil before the pandemic. I was sort of pulled into it because there was a need in our communities. So I was totally new to this work, and having this network of people to lean on was so important to me. We could have a place where we could sort of compare notes, troubleshoot, share ideas in a way that was really grounding. So I think, it gave us a network of people trying to solve the same challenges with creativity and heart. And I think you can hear that when you listen to some of these people talk.
Yeah, you have all built your bench, as it were. Okay, my last question to all of you is this. Today, again, National Rural Health Day, you use the hashtag Power of Rural. Lucy, I'm going to start with you. And this is my little game. Okay, so follow along. I'm going to ask each of you to provide one word, and you can't say what she said or what they said. One word to describe your definition of the power of rural. Lucy, we'll start with you.
I'm going to say innovation.
Innovation. Jennifer?
I'm going to say resiliency.
Resiliency. Ilana?
Collaboration.
All right, that's a great one. Connor?
Interdependence.
Phoebe?
Connected.
Chelsea?
Relationships.
Like it. Dave? Do we still have Dave? Oh, there he is.
Yeah, can you hear me?
Yep.
Yeah, I'm going with solidarity.
Love it. Ezekiel?
I'm going to say nimble.
Oh, I like that too. Andy?
Community-led.
Hyphenate. We'll accept that. No demerits for that. Thank you, Andy. Wow. Now, if you don't see what's in front of me, that this is the power of rural, I just don't know how to show you the way, because I cannot thank all of you. I've been working with this group since March of 2025. We did interviews all summer long. It has been truly a joy and an honor to meet all of you and to help tell your stories. And I just want to remind everybody that this podcast recording today, you're going to hear it on January 1st. Aside from being a part of it today, we've got some really cool post-production things that we're going to do. And really, it's about making waves in 2026 and taking this initiative and moving it forward and making these incredibly important investments in rural serving organizations, meeting people where they are and changing lives. That is to be sure. So thank you to all of you for joining us today. Don't go anywhere, though. Remember what I said. And right now, I just want to remind everybody, and see if I can get the screen up here, that we are going to make sure that you subscribe to our podcast. Go to the ruralimpact.com. And when you do that, you'll be able to get our e-blast and make sure that you can get all of our episodes that are coming at you without any hesitation whatsoever. It just drops right into your inbox again. So January 1st, 2026 is Making Waves, meeting people where they are. You can listen to us wherever you like to get your podcasts. You see all the logos up on the screen. You can also just listen to us on the website, theruralimpact.com. Follow us on social media. We sure do appreciate it when you do. You can find us on LinkedIn, Blue Sky, Facebook, all of those good things. And the last thing I want to mention to you is let us help tell your story. We are so happy to do that. We are taking the podcast on the road in 2026. And so we thank you again for joining us, and we hope you have enjoyed today's live stream event. Again, I'm Michelle Rathman, and we're going to see you the next time on a new episode of The Rural Impact.